Next, we have from University of Nevada School of Medicine, a paper that investigates the randomized control trial of laparoscopic partial task with a revised camera view versus reverse view orientation drills. Are you ready?
Yeah. Good afternoon. I'm presenting a randomized control trial of laparoscopic partial task with the reverse camera versus reverse view orientation drills. My name is Samaan Sattarzadeh. I'm a second-year medical student from the University of Nevada School of Medicine. I don't have a disclosure slide because I don't have anything to disclose.
And you have no money also. Go ahead.
That's correct.
Go ahead.
The challenges of laparoscopy include decreased visualization, decreased tactile feedback, two-dimensional view, fulcrum effect, and in some instances, the reversed camera view, which occurs in, for example, laparoscopic gastric bypass surgery, as well as in some instances in complex laparoscopic hernia repairs. So what brought on this study was that there were previous studies that showed that it took surgical residents, 470% longer to perform, to complete a task in the reverse camera orientation, while experienced surgeons took, on average, 65% longer to complete similar tasks. And this is compared to the forward camera orientation, which is a pretty significant difference in time, 470% longer to perform the task. The aim of our study was to identify laparoscopic warm-up drills to improve performance with the reverse camera orientation. So as far as our methods are concerned, we collected data from 30 laparoscopic novices. They were medical students from any accredited institution within the United States. The majority of them were first-year and second-year medical students, and all of them practiced the peg transfer drill to published expert proficiency levels. Then they performed the task with the reverse camera view. We divided the 30 students into 3 groups, 10 students in each group. We had 3 arms, one that practiced only with a forward-facing camera, one that practiced only with the reverse camera view, and one that practiced reverse camera spatial orientation drills, tracing shapes with the edge of the grasper. They were retested at 2, 5, 11, and 20 repetitions. We had pilot data that showed that decreases in time occurred. There was very little improvement after 20 repetitions, so that's why we limited it to 20 repetitions. Students were not allowed to practice for more than 1 hour at a time, separated by 24 hours to eliminate the effects of fatigue into the study. This graph shows performance by those who practiced the peg transfer drill with the traditional forward view compared to those who practiced the peg transfer drill with the reverse camera view at 2, 5, 11, and 20 repetitions. As you can see, the greatest improvement occurs after 6 to 7 repetitions, and those who practiced the peg transfer drill and then were tested with the reverse peg transfer drill were significantly slower than those who trained with the reverse camera view. This graph shows that those who practiced spatial orientation drills with the reverse camera view improved significantly, but were slower than those who practiced the actual peg transfer. When looking at spatial orientation drills with the reverse camera view, it did not improve performance that was significantly different than practicing the task with the forward-facing camera. We conclude that practicing a validated task with the reverse camera view confers a significant improvement in performance with the greatest change after 6 to 7 repetitions. the spatial orientation drill with the reverse camera view does not confirm significant improvement as compared to forward view practice drills. I would like to acknowledge a grant that I received by the AOA Caroline L. Cook-Hines Student Research Fellowship. Thank you.